that you are no longer as concerned with because they were walking wounded. And so you then focus on the wounded people, the more serious people, and those people can disappear because you have no way to hold them accountable or no way to track them, and that's where we missed that number.
Yeah, we didn't have the personnel to tag them when they were already up in the area, and then no one was there to supervise them, so then they just started wandering off, probably per their instruction as what to do. Because there was like a lady, like 5 times I had to tell her to go back to the green tarp, and she was trying to make like a Walking Dead exit.
Yeah. And it goes like to show, call as many resources. So if we get there and they say 70 souls on board, I would be like, let's call for 100 ambulances, just so we have enough resources to handle it. Because I know we were simulating a lot of ghost ambulances or whatever, but it seemed like we were waiting and waiting and waiting, which is reality, but waiting for all these rigs to come while we just stood there. So it's like, I mean, we were doing treatment, stuff like that, but having more resources would have been great to monitor those greens, to track everybody, if somebody for Stokes, to help him. More resources, which is...
So basically what we're discussing is, if you're the first one to arrive on a mass casualty incident, something of this magnitude, what is the responsibility of the first arriving apparatus or ambulance apparatus they will look at it. And what we're kind of coming down to the conclusion of is to yell all the walking wounded need to come over toward the ambulance, and then they're inundated with 40-some people on top of it, and they're there by themselves. Feeling maybe better off seeing size up what's going on, what truly needs, what we need would be better than trying to get 40 people on top of an ambulance with 2 people in it. So he said basically what they're thinking is, if you waited for the resources numbers to get bigger, then they'd have someone to help control all the walking wounded, and it wouldn't be such an inundation on top of them. And if they were actually trying to control the greens and trying to hold them into a certain spot, they weren't able to do it with 2 people. Plus, they had the rest of the scene right away. So maybe delaying on the PA to say, hey, we need all the greens. Because worst comes to worst, if you're triaging, you come up to a body and you say, hey, can you walk? And then they say, yes, okay, we need you to walk toward the ambulance. That's not delaying triage with seconds, so that is not a huge thing. So like I said, their main concern was when they first called for all the walking wounded, and all of a sudden there's people on top of them, and there's only 2 of them, and then they couldn't really kind of do what they needed to do because all the walking wounded inundated them.
Yeah. Another thing, the vests that the commander would drop off, those are pretty essential. We got dinged on that in prior events, and that really helped for when people from outside of our department arrived. They knew who they were going to speak to. It's easy for us to say, oh, go speak to Captain Collins, but when there's somebody else who arrives, you need to have the vest identify who you are. And we had that this time, and that worked well.
I got one more thing just because I know Stokes isn't here to kind of touch on the transportation part of it, but I know when after I got put in treatment for a while, I got put into transport, or being one of the transport units, and I noticed when we dropped patients off, and not only just jotting down information for the transport supervisor, like what their age and, injuries or male, female, or name or whatever. But the other things that we didn't have was on the cards themselves, the triage cards. There were no vital signs or anything that had been initially put down. So when we're transporting that patient, if we're taking a second set or a third set or whatever it is of vitals, we didn't have anything to compare it to. And then when we dropped that patient off at their hospital, we didn't really have anything other than just what was on their card, their description card that kind of gave us initially our triage information, but we didn't have anything to let the receiving hospital, we didn't have any information about that patient, what treatments had been done, if they had an IV started or if they had any fluids given to them. We didn't have any information like that. So something for future exercises like this. I'm sure it'll be different in a real life event because you're going to be actually talking to the patients and getting information from them.
Yeah, that falls back onto the re-triage.
Yeah.
As to where you should be writing down that information, like I mentioned earlier, maybe just like vitals,
Yeah.
if appropriate, what treatments were done,
Right.
getting some demographics, name,
Yeah.
stuff like that. So
Yeah, because we didn't have anything when we dropped patients off. We didn't have any information on those cards at all that told us what the receiving hospital needed to know. So that'd be a good point for future treatment exercises to start writing some of that stuff.
And some of our assistants that came from other departments, I don't even think that some of them even seen a triage card
Yeah.
before, so that's kind of on them. So maybe some specific instruction needs to be relayed to them as to what they should be doing
Right.
when they're assigned a specific duty.
Yeah.
You know,
I heard, was there any issue with like names if somebody comes to the scene and they're looking for Mary? I mean, we use numbers on our triage cards. Is there anything, that happens in that type of scenario? I'm just guessing that, I'm looking for my dad,
Stokes
John.
brought
How do
up
we
the only
find
thing he had to go off of was the triage barcode number that was split off from the triage tags. So he couldn't even refer to where Mary went to hospital wise, but he had a barcode and numbers to go off of as far as tracking. So then it'd fall onto like what hospital could line up that specific number.
But there is a way to track that with that barcode, because the big card is the triage card, and then the transportation has a tear-off little card, and both of them have a place for a name and some information. So if you fill both of those out in the treatment area, would probably be the best place to fill that out. And obviously, if they're unconscious and it won't speak, then that's just you would just have to put male, female, whatever, John Doe, or be a lot of John Does maybe. But if you can get a name and off of them and their age, at least put that on both sides of the card, so that would be helpful later on when people are actually looking for a specific person. You'd have a little better chance to know where they went.
You guys have anything else?
I think we're good.
Should I pretend to shut it off until the conversation comes back up?
Yeah, so keep holding it.
Thank you very much.
I think we got it.